everyone, I'm Britny Brown. I am a clinical assistant professor at the University of Rhode Island and also an oncology pharmacist at Women and Infants Hospital, where I have my clinical site. I graduated from the University of Rhode Island in 2013.
So my first question for you, I'm sure a lot of the people watching this are prospective students, so why did you choose to attend URI?
So I actually, as a Rhode Islander, was very hesitant to go to school in Rhode Island. I wanted to get out of the state and see something different. But then when I started touring colleges and talking to other friends who attended the University of Rhode Island, I learned that it's a very different environment than what I had been expecting. Because we do have so many students here, it's really easy to create your own sense of community and personalize your experience throughout your college years. So when I did come to URI and I went on some tours and then also got a chance to shadow a pharmacy student, I really felt that sense of community in the pharmacy class. Everyone was very collegial and social with one another, and I could kind of just sense that. And when I did attend the University of Rhode Island, that fortunately held true throughout my years and then beyond graduation. So I'm 8 years out of college and still text all of my friends from the class of 2013 every day.
Yeah, I definitely agree with you. I know going to URI, I was nervous, leaving my friends from high school, but I instantly felt like I found a family within my pharmacy class. And even among the different years in the program, there really is such a strong sense of community.
Absolutely.
And how do you feel that the URI pharmacy program has helped prepare you for your current role?
Yeah, so I believe that the URI Pharmacy Program provides you with a strong baseline knowledge and also a skill set. So two separate things that help to adequately prepare you for your future career. My career right now is a mix of academia and oncology. And since those are both very dynamic fields, you do need to be able to learn things on your own. And I believe that the skill set that I obtained from URI is what helps me to do that in an efficient manner.
So, kind of going off of that, what made you decide to want to do oncology in academia?
Yeah. So I have always had a passion for cancer care. And when I was in school, it was something that I did a lot of outreach events with, and just had a lot of empathy for people who were living with cancer. And I remember being in the oncology curriculum in our P3 year and being really inspired by Dr. Charpentier and all the stories she shared about how she cared for patients and the little things that she could provide as a pharmacist to help them get through their treatment. And then I was super fortunate to land in kind of serendipitously, one of my electives changed last minute, and I ended up in an oncology rotation. So I had known that I wanted to pursue residency, but that rotation solidified my interest specifically in oncology. And then I also had an elective in academia where I worked with Dr. Jacobson. And that was where I learned that I have this true passion. I had always been involved in mentorship throughout my years at the university, but that academia rotation gave me that initial exposure to working closely with students and being able to kind of foster a sense of belonging with them, and then also to help them connect the dots in their school career.
So, how might someone interested in academia go about approaching that area of practice?
Sure. So academia is tricky. I wanted to explain one thing about this specifically. So I wanted to clarify that people who are interested in academia don't necessarily need to be a faculty member. So you can guest lecture for colleges of pharmacy that you have relationships with, and you also likely can be a preceptor. So you will have the opportunity to become involved in some shape or form if you just connect with your local school of pharmacy. In addition to that, however, if you did want to specifically pursue academia, probably the easiest way to go about that is to do some form of postgraduate training. So that might be residency or fellowship. And then to make sure that academia is somehow infused in that with precepting, and possibly also a teaching certificate or some sort of didactic education that you provide during your residencies. Um, that being said, that is absolutely not required. So there are other paths to do it. Just maintaining that relationship with the School of Pharmacy, having that experience under your belt is something that would absolutely qualify you for a role in academia, if you do have that proper experience.
Yeah, I think that's definitely one of the greatest things about pharmacy is there's so many different paths you can take to get to the same end goal. I was wondering if you could describe your specific path following graduation and what brought you back to URI.
My path was kind of windy, and I had maybe 5 different jobs in 5 years, which was kind of fun but also tumultuous and a lot of moving. So I did my PGY1, or my postgraduate year one residency post after graduating in 2013 in Philadelphia. And so that was just a general practice residency at Hahnemann University Hospital, which has since dissolved. So my preceptors from there are all over that area. I then went on to my PGY2 in oncology at Roswell Park Cancer Institute in Buffalo, New York. Go Bills. And obviously developed a passion for Buffalo sports because that's just what you do. So there, I had an amazing experience, and found a passion in everything that I got exposed to. Thereafter, I worked as an oncology oral chemotherapy pharmacist. So I helped at the University of Vermont Medical Center to get patients connected to their oral anti-cancer drugs, to educate them on it and to help them and monitor them on their treatment to make sure that they were able to continue their therapy and also get through any side effects they experienced. And then I went back to Buffalo for a short time, where I worked in an outpatient oncology clinic and also had some other pharmacist roles at a large academic hospital. And then I came back here, the position opened up, and kind of a once in a lifetime opportunity to teach where you went to school, and where you are from. So couldn't turn that down and came back to Rhode Island, and have been here ever since then. So about 2017, I came back.
We're glad to have you.
Thank you.
What has been the most rewarding aspect of your career so far?
Oh, that's tough because I feel very lucky to work here. I've been speaking to this dual role of academia and also clinical practice. So I get a ton of rewarding experiences. From the clinical side, it's always being able to have a positive impact on someone's cancer treatment. So sometimes that's just providing a little education. Sometimes that's helping to manage people's symptoms. But that, of course, is the most rewarding part of that. And then with academia and working at the university, I think this is tough too, but I think what is most rewarding for me is seeing students realize their potential, and being able to instill in them the confidence that they need to succeed. So, sometimes that's providing education, but sometimes it's just showing them what they're already capable of.
So, kind of going off of that, you spoke to this dual role that you have, and I'm sure that can be challenging at times to balance both the clinical side and the academic side. So, could you describe kind of the balance that you have with both sides?
Yeah, sure. I would be lying if I said it wasn't challenging. It is, and especially having come from a clinical practice where I was wholly devoted to that site. I know what I'm capable of doing if I had 40 plus hours a week. But what I've found is that really setting expectations for both sites, so both for the university and for my clinical practice site, and having set days that I'm there and I'm available, and then also communication. So knowing, letting them know when I won't be there and how to reach me if they need me, has been extremely helpful. So kind of setting those boundaries, and then also always remembering that, my students come first. Of course, patient care will always take a priority as well. But if there isn't, an urgent patient care need, I have the students in mind. So whatever is going to benefit them is what I prioritize.
And what does a typical week look like for you? I know oftentimes people ask, what does a typical day look like? But there really is no typical day. So what does your week look like usually?
Sure. So things are my typical week, I would say, where I have both school and rotation students. Usually I am on site at my clinical practice site 3 days a week. So Monday, Wednesday, Friday. And I'll go to rounds in the morning with my team. So that includes medical residents, pharmacy students, fellows, so medical fellows. We also have registered dietitians on the service, case managers, chaplains, and physical therapy that attend our rounds. And so we'll go through each patient and talk about their needs for that day. We then, because we round so early, we'll go back and review everybody as their labs result throughout the day and provide any recommendations to the team on any changes that need to be made. On Wednesdays, we also have palliative care clinic. And so if we hadn't already reviewed the patients for that day, we'll spend time reviewing them. And we will obviously go to clinic. We're a big part of their medication reconciliation process. So we go in, try to figure out what they're currently taking, what their goals are for the visit, and then provide suggestions to the team on how to manage whatever it is that they're dealing with. And then at the end of the visit, provide any necessary counseling for them. And of course, as a part of that, we do follow up with those patients by phone as well. So that's another opportunity that my students will be involved with. So that's kind of Monday, Wednesday, Friday. And then of course, meeting with those 6-year students on rotations and doing topic discussions, journal clubs. And then my Tuesday, Thursdays are usually my class times. So I have an undergraduate class in the fall, and then small group classes in the spring and lectures throughout the semester. So those will meet typically on those days, and yeah, we get to chat either in lecture format or in a small group format and review patient cases together.
And my last question for you, you are in such a unique role, having been both a student and now being a professor at URI. So what advice do you have for incoming students?
That's a very good question. I think, if I could do it all again, I think the one thing I might change is to explore all of the non-pharmacy organizations. So even if you don't know someone who's in a specific organization, if it sounds interesting to you, just try a couple meetings and see if it's something that you'd like to do. I was fortunate that I did become involved outside of the School of Pharmacy kind of earlier on because I knew someone. And that really helped keep me grounded throughout my time at URI. Because you will be with your pharmacy people, every day in all of your classes, and you'll have plenty of opportunities to get to know them, but you'll have less opportunities to meet people outside of pharmacy unless you seek those out. So that's one thing I would remember. And then the other thing I would say is that, especially in the professional pharmacy curriculum, there will be a patient at the end of everything you learn. So when going through class and studying, it's really easy to fall into the trap of studying for the exam and to try to get that A, but always to remember that there is a patient at the end of each patient case or what you're studying that day. And so if you maintain a patient-centered vision, you'll definitely thank yourself later because you'll be much more prepared for your career.